Hi, everybody. We are happy to see you all or to see your names in the magical list. I am Michael Munson, for those of you who don't know who I am, and I'm happy to be here in space with one of my favorite providers who's a lot of fun and who's going to be our guest speaker tonight. So Annie's smiling face is already on, and we're excited for the evening of discussion. Let me just do a couple of bits of housekeeping. So I think most of you know who Forge is and what we do. So let me just do a little bit of housekeeping. So we are recording tonight, and we're going to have kind of a split view tonight. We're going to have a little bit of presentation, and then we'll have some discussion. So I promise you, we are not going live right now. This is just being recorded, and then we will edit that recording so that nobody's faces is on the recording when we publish it. So if that alters how you would like to participate tonight, please, think about that, or let me know, or let Shelly or Caleb or Loree know, who are all kind of on the back end tonight. So we want to make sure that everybody feels safe and comfy and cozy. As many of you can hopefully see, we have ASL interpreters tonight. If you'd like to pin them, you should be able to hover over their image and click pin so that you can always see them. Or if you want to see Annie all the time, you can pin her, but you'll see her because she's going to be front and center. And if you would like to change your name on your Zoom account, you can just hover over your the participant list and go up to your name and right click and change your name or your pronoun if you'd like to include any of that bit and piece. I think that those are mostly the housekeeping bits that we have to talk about. So I am excited to have Annie with us again. We did some fun things together last year. She did some fun things for us last year, and it'll be a really fun way to kind of start this year, even though we're already in April, to kind of have a welcome back. And our world is a little bit different this year than it was last year. Not a lot, but a little bit. And so Annie's going to share with us information about vaccines, some of the common concerns that many of us have, what we should know, what we maybe don't need to know so much about, and lots of those good things. So Annie's a nurse practitioner and a primary care provider at the Inclusion Health Clinic at Froedtert Medical College of Wisconsin. And I'm going to let you, Annie, tell people a little bit more about who you are, and know that we're excited to have you here. So thank you.
Great. Awesome. Thanks, Michael. I'm absolutely thrilled to be back. This is really a pleasure. So I'm Annie Lakatos. I'm a nurse practitioner. As Michael mentioned, I've been a nurse practitioner since 2009. And so I want to clarify with everyone, I'm not an infectious disease specialist, but I'm certainly someone who has, like you, lived through 2020 and the COVID-19 pandemic, which we continue to navigate. So I'm excited to share information tonight. And I'm hoping this provides the space for all of us to connect and at least hear some information that could be helpful, and then to allow some discussion and questions afterwards. So tonight, what I'd like to talk about is what you need to know about the COVID-19 virus, but specifically the vaccinations. And so we're going to talk about what vaccines are currently available, what the responses and reactions to the vaccines are likely to be. And we're also going to touch upon vaccine hesitancy, safety, and efficacy. I also want to talk about what you should do or what you could do with this information. And very importantly, why you should care about obtaining this information. And then we're going to talk questions and answers and discussion. So let's start here. This is the gorgeous picture of the coronavirus. So as many of us know, the coronavirus is a virus that is passed primarily through respiratory droplets. So this has been something of an evolution for us all over the last year. I don't know if you remember a year ago that we were disinfecting everything that we touched, including groceries and mail and that sort of thing. That has certainly evolved over time. And the experts really feel that this is passed along by respiratory droplets, including, through speaking, singing, that sort of thing. We do also recognize that there's a proximity and a duration of exposure, which means that if you are within 6 feet of a person, and there's some talk about it being only 3 feet, that if you're in that close proximity of a person for more than 15 minutes, that would be considered an exposure. There's also some suggestion that poor air circulation can also increase infection rates. We do anticipate that if you are exposed, that symptoms may evolve over 2 to 14 days. And so you may essentially be asymptomatic for a period of time and then develop symptoms as late as 14 days after that initial exposure. The most common symptoms continue to be fever, cough, fatigue, and difficulty breathing. There's a number of other symptoms that people experience that's also consistent with COVID-19 infection. But this is really just a review. It's really important also to understand that over 3 million people have died from this infection worldwide. So I want us to keep that number in mind as we go forward. So we currently have 3 vaccines that have received this emergency use authorization in the United States. And as many of us probably are aware that the Johnson & Johnson, also known as the J&J vaccine, was paused for 10 days. We're going to talk about the J&J vaccine tonight. There are other vaccines in the works around the world. You may have heard of the AstraZeneca, the Sputnik, and others. And those are being produced and rolled out in different countries. So we currently have these 3 in the United States, the most common. So we have the Pfizer, that's a 2 injection series separated by 21 days. It is an mRNA vaccine. We're going to talk about what that means. And that's indicated for people 16 years and older at this point in time. There are studies that are currently looking at younger than 16 years of age. We also have the Moderna, and that also is a 2 injection series separated by 28 days. And that's an mRNA vaccine as well. That's indicated for people aged 18 and older. And then we've got the Johnson & Johnson. It's also referred to as the Janssen vaccine. That is a 1 injection, one and done kind of thing. It is called an adenovirus vector. So we're going to talk about what that exactly means. And that too is indicated for people 18 years and older. So let's talk about how these vaccines work. Full disclosure, I had known about some of this over the last year, but really this talk prompted me to look into it a bit more. I've heard a number of people's concerns regarding the production of these vaccines, and I hope that we get to discuss that tonight. But just starting with the mRNA technology, this technology has been around for at least 30 years. So one of the reasons that the production of these vaccines were able to be ramped up so quickly, and I would say that we were all surprised, that a vaccine could be developed in such a short period of time as to less than a year, is because the technology was already available. This vaccine consists of synthetic components. So unlike the flu virus or the flu vaccine and some of our other vaccines, this didn't take a part of the actual virus and put it into the production line. This is all synthetic. So there's no coronavirus in this vaccine. What this technology does, though, is it teaches our cells to create a spike protein so that mRNA goes into the cell and it induces this learning process. And then the cell actually takes those instructions from our vaccine and destroys it. But once that spike protein is developed on the surface of our cell, our body produces an antibody response. And that's what people oftentimes will experience after a vaccine. So they'll have symptoms that we'll talk about. So one of the bits of information that I want to make sure that I communicate is that the mRNA does not and cannot go into the nucleus of the cell and change our DNA. So there has been some information out there that states that this might affect our DNA. It literally cannot do that. So there's no possibility of this becoming part of our DNA. I thought it was really interesting, actually, that this mRNA technology has actually been used in cancer treatment. And so it's important to realize that this isn't just, off the cuff and something that hasn't been seen by the medical community before. If you do get one of these vaccines and you are allergic to any ingredient or had an allergic reaction to that first vaccine, so what is an allergic reaction? It's wheezing, it's hives, it's difficulty breathing within 4 hours of receiving that vaccine, then I would suggest talking to your healthcare provider about receiving that second one, or just making someone aware that can guide you through the process of how to address that second vaccine. So it's important to say that. So the adenovirus vector works a little bit different. So this is our J&J vaccine. This is a vector that is essentially goes into the cell. It does very similar things in terms of prompting the cell to produce that spike protein and then create an antibody response. The difference is that it doesn't involve that mRNA, and I'm not a microbiologist, but this is, I think, some people suspect that this might be one of the reasons that the J&J is different than the Pfizer and the Moderna and some of the effects that we're seeing. So again, we anticipate an antibody response when we receive this vaccine, and those can be some very mild to somewhat strong symptoms. Again, if you've had a reaction to this virus or this vaccine, definitely let someone know so that that can be included in your medical record. Okay, so in those two different ways of working, so the mRNA technology and then the adenovirus vector, we are looking for an antibody response. That's the whole point of vaccination, so that you can have the protection of that response without getting sick, essentially. So when people do get the COVID-19 infection, they too will develop antibodies, and your body will have to fight both the infection and then kind of develop this antibody response. I do tell folks this, and I would say in some cases it can be a little longer than 24 to 36 hours, but after getting a vaccine, you may feel symptoms that includes low-grade fever, fatigue, body aches, chills, very commonly pain at the site of that injection. So just to be aware that that is what we anticipate will happen. I remember Dr. Fauci being online and being like, yeah, I had this low-grade fever for 36 hours. He was pretty chill about it. And I'm sure he didn't feel great, but definitely we want to make sure that people know that that's just what we expect from vaccination. I think it's very important to talk about vaccine hesitancy. This is something that I am reading in the news on a daily basis. And actually tonight, I just received another email from the medical college about how to talk to folks about the hesitancy. I'm going to go through this slide and then I'm going to share with you how I address this in my appointments, because it's important, I think, just to be aware of some of the challenges that may be out there. The hesitancy and the concerns about vaccines have definitely been growing in the last years. There was a measles breakout in 2019, and it was thought to be related to the fact that people are just not getting their vaccinations. So measles is something that can be avoided, and through vaccination, it's definitely something that no one wants to get. There are some long-term implications to it. Unfortunately, this hesitancy has probably mostly manifested from untrue published data that has since been debunked about the link between vaccines and autism. It is not true. It's been debunked many, many, many times. Unfortunately, it has stuck. The other piece is that as we become a more virtual community, we have a lot of information at our fingertips. And I know I've said this before, that all things are not created equal on the internet, and this continues to be true for vaccine information. Currently, the most common websites for vaccine information are Twitter, Reddit, Facebook, Instagram, and Gab. Unfortunately, that doesn't include the CDC, and I'm not sure what Dr. Fauci's presence is on those sites. It's also critical to know that these sites oftentimes will focus on patterns of use, as well as emotions and personal anecdotes. So it can be it can be very engaging to meet a group of people that have similar experiences or concerns. The important thing is to make sure that you're balancing that out with additional information at other sites. So I'm hoping to give you some of those sites tonight. Unfortunately, those evidence-based sites are a little bit less appealing. So things like the CDC, the FDA, those sorts of places are not like big grabbers for people. So if you find yourself in a situation where you're wondering about people's resources, that's a good place to be. You want to make sure that you're asking yourself, how do they know that? What information, where do they get that information from? Another question that does crop up. Oh, I'm sorry. I'm going to go back. I apologize. I wanted to just explain a few things too about vaccine hesitancy. One of the things that I do talk with my patients about very candidly is the fact that in many cases, we are in a situation where people have experienced both mistreatment and marginalization by the medical community. So there's a lot of hesitancy based on mistrust. That is absolutely based in truth. I think that we are, as a medical community, trying to work through that and be a little bit more aware of it. For example, the last 400 years for African Americans have been a very tough experience within the United States with documented mistreatment for 400 years. So I will approach that subject with my patients, and I will invite that space so that we can have a candid conversation about what their concerns are or what your concerns are when looking at whether or not this vaccine makes sense for you and what your challenges or barriers are. And I think that truly as a medical community, recognizing that we have people that we have unfortunately pushed to the margins through many, many years. And I'm hoping that that's changing and that we're bringing people closer to the table and being a part of the conversation more actively. So I just wanted to make sure I covered that. All right, so vaccine safety. How do we know that these are safe? That's such a great question. So just to give you some perspective, there were 211 million doses of COVID-19 vaccines that were administered from December until now. That is a huge amount of vaccinations. I think it's also important to understand that 3,400 people have actually passed away after receiving a vaccine. And is there that risk? There's absolutely that risk. I want to just remind everyone that over 3 million people have died from the infection. With the folks that have died after receiving the vaccine, the CDC and the FDA did not find a direct link related to the vaccination. But it's also really important to know that the CDC continues to monitor that. So I'm not sure if anyone has ever heard of the Vaccine Adverse Event Reporting System, and that is a site online that you can go to if you have a vaccine reaction that you're concerned is not to be expected or abnormal. You can certainly report that. The other thing is that I'm not sure if anyone has received their vaccines, but once I received my vaccine, I was actually invited to take part in a response I think sharing, I would say it is. So every day after I received my first vaccine, and then every day after I received my second vaccine, I reported how I was feeling, if it affected my work, if it affected my function. And actually they keep sending me a text message every month now, just to check in and say, how are you feeling? Have you been diagnosed with COVID? You know, how's your functioning? So, and I would say as a person who has received these vaccines, I really appreciate that, because I want to make sure that we are monitoring the safety of these vaccinations and the response. So let's talk about that J&J vaccine. So as many of you might know, it was put on pause in the United States for 10 days after the discovery was made about very rare blood clots. So 6.8 million doses of the J&J have been administered up until that point. And then 15 people were found to have this exceedingly rare blood clot. And that developed 6 to 13 days after receiving the vaccine. The people that were affected, and when I was looking at this information, I made some assumptions. So it was 15 people. They were all what I would assume were cisgender females. And essentially the majority were between 18 and 49 years of age. So just to break that down, it was essentially like a 1 in a million chance that you would develop this blood clot after receiving the vaccine. As early as today, and I feel like I've been working on these slides every day because it changes every single day, but as early as this morning, I heard that, that there's now a blood test that can be run if someone is concerned that a blood clot like this has been developed. And then there's a treatment that has been developed as well. So there is a response to this blood clot situation. What were those symptoms that the people affected experienced? It was that severe headache, shortness of breath, leg pain, abdominal pain. And so you want to monitor yourself 3 weeks after receiving the J&J vaccine. So another thought is, I was talking to another healthcare provider about this, and it's specifically because it did affect cisgender females. I was thinking about people who are assigned female at birth, or people who are on estrogen therapy, feminizing hormone therapy. What would my recommendation be for them? And so I hope that we get to talk about that during the discussion. All right, so how effective are these vaccines? This is the preliminary information. It has shifted a little bit since the rollout of the vaccination. So Pfizer was found to be about 95% effective at preventing COVID. This was based on one particular study with more than 43,000 people. That's important to know, just so that you know it's not, you know, a group of 100 people that they just took a look at. And that actually started rolling out in December. Moderna, very similar efficacy rate of 94.1%. Again, about 30,000 people in their study. They too received that emergency use authorization in December. Since time has passed and people are monitored for the response to this vaccine, it is a little bit closer to a 90% efficacious rate. So just to be aware, it's still very, very highly effective. It's not quite as high as 95, 94%. It's about 90% in real life, essentially. And then the J&J was 66% effective. And their study had about 40,000 people, and they received that emergency use authorization in February. All right, so now what do we do with this information? I'm sure that you all have seen these things all over the place. So it's about hand washing, it's about masks. There's a lot of data out there that recommends hand washing over hand sanitizer. I would suggest using one or the other. And just being very mindful about hand hygiene, especially before you eat, touch your face, that sort of thing. Those are all rules that we have probably all heard throughout the many, many years of our lives, but it's important just to reiterate that as well. So here's the million-dollar question. Why should you get a COVID-19 vaccine? I think it's important to recognize that this is one of the tools that we have available to us to change what our life has been like. And so when we're thinking back to 2020, I couldn't help but just write it was a tough year. And that one statement is just loaded. And I think we all can think about how 2020 has affected you. I know that were wonderful things that happened in 2020, but it was a really tough year. And as I heard earlier, this is our 6th quarter of 2020. And so it's important to recognize that we have some say in how the rest of 2021 goes. And one of those ways is through getting a vaccine. I think it's also important to say that if you do get infected, you may actually just have mild symptoms. I have heard many people say, I barely had a cough, or I had a cough for 4 days, or, you know, I had a fever once and that was the end of it. And that I'm grateful to hear that that was their response. The piece that I'm very concerned with is that if you were infected, that could have been passed on to someone else who may not have or develop mild symptoms. And people, we don't have a pattern of who gets mild symptoms, who gets severe infection, and who dies. Unfortunately, there are trends towards certain ages, different comorbidities or health conditions, but truly, I see people who were previously very healthy have very long-term effects from this infection. And really, I'm missing people's faces. One of the benefits of virtual anything for me right now is that I get to see everyone's noses and smiles and, 2/3 of their face that I typically miss when I'm at work and I'm all masked up still, and they're masked up. So let's get back to seeing each other. That would be great. So what should you do? I would say if you have any questions about the vaccines, talk to your provider. They will specifically give you recommendations to say, yes, I think that you should get this. You can absolutely talk about your concerns, your fears, what you're most concerned about after the vaccine, anything. I would also recommend taking a look at the CDC or the Wisconsin Department of Health sites. Those have information. I'm going to actually share a little bit from the Wisconsin Department of Health tonight, but they have a lot of information available to us to take a look at. And unfortunately, I would say continue to stay 6 feet apart from people, specifically folks that you're not sure received a vaccination or they're not in your primary household. Please, please continue to wash your hands. And I would say that wearing a mask continues to be an important step. The flu season this year, interestingly enough, was very small. So we typically see anywhere between 12,000 to 70,000 cases of flu per year. And this year was 22,000. And so that's exciting, most likely related to a lot of all the care that we're taking to keep ourselves safe from the coronavirus, but it certainly affected those flu numbers as well. If you have received the vaccination and you're outside and you're like, why am I wearing a mask? Really at this point, it's just to be in solidarity with people. You can't tell who has been vaccinated and who hasn't. It's a very simple gesture and it's for the time being as well. All right, here we go. So what are we seeing in the world? This has been a really interesting development. And I think it's important, again, to look outside of our own walls to say what's happening in other places. And I want to start with just looking at Israel. They are literally going back to pre-COVID activities. And I saw an article where they are now starting to schedule concerts this summer. And so the exciting thing is that every age group has really gotten a lot of vaccination done. So 75% has been vaccinated in each age group. The exciting thing too is that they're only reporting about 100 new cases per day. So this really is the example of what we want to be at. We want to be where the virus isn't able to morph into something different and become more infectious. This is where we want to go. We want to go back to those concerts. We want to go back to being together and enjoying the sunshine together. As some of you may know, that the situation in India couldn't be more different. So it is devastating to hear the news from India that the hospitals are struggling with seeing patients, with actually getting oxygen for patients who are admitted. The vaccine rollout has been very complex. In addition to that, I think that there were a lot of restrictions that were lifted, and unfortunately, the virus has been allowed to just take off. It's devastating, again, to hear how many cases are emerging from India. So those are the two ends of the spectrum, I would say, that we're seeing right now, and many of us are in between that. So this is what the world looks like, essentially. So I think it's interesting to see how it's developed. The rates of cases per day have developed since January. So we had a bump, and then we had a trough, and then we're kind of going up again. And then these are the deaths. And this is, we care about this. With that being said, what I don't have in front of us tonight is the longer term effects. We're going to talk about that in just a moment. But for every person who has been infected and survived, what does life look like? And that's not captured on this at all. So what do we know about life after having this infection? I think that the term long haulers or long COVID is more common than this post-acute sequelae of SARS-CoV-2. So that's a bit of a mouthful. So long haulers or long COVID is very common. it looks like that 50 to 80% of people continue to have symptoms after the infection is over. That's a lot of people. And unfortunately, those symptoms include fatigue. And for any of us who are tired at the end of a long day, imagine having that all the time. We also hear people talk about body aches, shortness of breath, difficulty concentrating, headaches, difficulty sleeping, and difficulty exercising. So really it affects your function, your quality of life. It's one of those situations that you want to be able to avoid. You want to reduce your risk in developing this infection at all costs with all the tools that we have available to us because of this. Okay, so what does Milwaukee currently look like? This I just received, or I just obtained for us to take a look at. So really, we definitely had a spike around November or in November, but it has certainly improved over time. And then this is our vaccination rate. So it's exciting to see it going up. I think that there is a lot of interest initially, and we want to make sure that that momentum continues. We want to make sure that everyone gets vaccinated, especially those that are really at high risk of getting this infection. All right, so I was trying to find a picture of Hamilton when I saw Take Your Shot, because that's the song that goes through my head. This literally just came out today from the Wisconsin Department of Health. This is one of the ways that you can get a vaccine. And so here's this information. I've got about 3 more slides of places that you can get your vaccine. And I know that our clinic is also talking about how we can provide an opportunity for patients who are connected to us in getting a vaccine as well. So this is one place. I'll certainly make this available to Michael so that he's got this to share as well. Here's some more information. So there is actually a Wisconsin vaccine registry that you can sign up for. We have walk-in clinics, and these will pop up. A number of my family members have done this as well. And so it's important to know that no personal information will be taken. People just need to get vaccinated. We need to get folks to these locations. And then the typing gets even smaller, because look at all our health departments. So you can absolutely call your local health department and help, or you can get some information from them to get yourself a vaccine as well. And then pharmacies are also an option. And a lot of the sign up occurs online, but you can certainly contact your local pharmacy and say, I really need a vaccine. How do I get this done? All right, so that's me done. I'm going to stop sharing and we will launch into a discussion, hopefully.
So I know that Annie is excited for questions, and we want to stump her. So let's come up with some good questions for Annie to ponder over. So feel free to, you can ask by voice, you can ask in the chat. However makes you feel most comfortable.
I kind of did a cliffhanger there. I don't know if I did that on purpose, but I wanted to share what our approach is for anyone who is concerned about that J&J vaccine, who may be concerned about the blood clot risk. At this point in time, it should be okay. That's our party line. With that being said, if you have access to one of the others, that would be okay as well. So if you do have any concern about your blood clot risk for whatever reason, personal history, medications that you're taking, whatnot, we have access to the Pfizer and the Moderna, and they're great vaccines as well. So
as people are thinking about their questions, let me start with one of them. And I heard you say, Annie, something that was different than what I had heard.
Okay.
Because one of the questions that I had for you was about trans people feeling concerned and nervous about having to show ID.
Yes.
So like I got vaccinated through the health department downtown, and I had to show ID. And for me, that's not a problem, but it would be for some other folks.
For sure.
Did I hear you correctly that not every place is asking for ID?
Correct. And so yes, you're exactly right. And I think that's an important piece to know, especially for anyone who doesn't have an ID that is consistent with where they're at, or that it's just yes. But there are opportunities. Really, I think that there is such an important plan to outreach to folks that we just want people to get vaccinated. You may have to give basic information, your name, your date of birth, that sort of thing. You can also, and I'm sure, Michael, that you went through this as well, you'll probably have to sit for 15 minutes after the vaccine, make sure that you tolerated it well, and then off you go. But yes, so when it comes to IDs, that is not required at every location.
And let me just ask a follow-up question while people are thinking about their next questions. Where would people find out if they have to show ID or not? You know, is that available on the websites, or how do they find out?
That's a really good question. Let me just take a look at that slide again. So it's the City of Milwaukee walk-in clinics, and it's the ones that are located at North Division, South Division, and Northwest Health Center. And I will definitely leave that information with you to provide. So no personal information such as immigration or SSN or the social security number or any personal information will be required. I know when I received my vaccine, I don't believe I had to show an ID. So you can always call that location that you are intending to go to and say, what information do I need to bring? The other thing is that I'm really hoping that our clinic is going to provide an opportunity for our community to get vaccinated as well. And that information will be forthcoming. So that's in the development stage.
And I know I had reached out to Joanna about, could we have a trans day or something to encourage folks, because it's sometimes it's really hard for folks to go to a public space and be in that environment to have to interact with people. So
for sure,
yay.
For sure. Yep. And so then you'll see all of us there. So
really cool.
Yeah.
So we have a question in the chat, which is, how long after getting vaccinated are you as protected as you're going to be?
Oh, that's such a great question. So the first part of my answer is going to be, if you get the Pfizer or the Moderna, I would suggest being ready to be fully vaccinated 2 weeks after that second vaccine. And again, with the J&J, it's 2 weeks after that initial vaccine that you will have that full effect. So that 90% efficacy rate or 66% efficacy rate. The data is currently emerging that we are protected for at least 6 months. And that's part of the nuance of this, is that we don't know. And so that information is going to continue to develop. So at this point in time, we have at least 6 months of protection. You will continue to get updates about how long that you have the protection. Now, there has been some talk about boosters, so we might have that to look forward to. That kind of gives me another bit of information I want to share, that if you are due for other vaccinations, depending on the vaccine, you want to wait at least 2 weeks between your COVID vaccine and any other vaccination. So and that will certainly be, I think, publicized in the fall if we do need to get, boosters, or sometime this summer, we'll have that information.
So I'm seeing another question that says, is it okay to get the Pfizer second shot at 28 days, not 21? This is what Walgreens is doing.
Yeah, so it is. It's important to get it. There's a window to everything. So I want to say that the data really supported getting that second vaccine anywhere between 17 days and 36 days, something like that. And so there's a window. You don't have to get there on that 21st day. So yes, what Walgreens is doing is well within that window of opportunity. That's the hard thing about having these 2 steps, injections, though, is that you have to come back. And so make sure that you schedule that appointment before you leave after your first vaccination, so that you know when to come back for that. Oh, isn't that such a great question? Thank you for that question. I would say that it all is on us. So it depends on how we want to utilize the tools available to us. Unfortunately, every state is also having different rates of infection again, and different vaccination rates as well. And so it all gets down to that process. Reassuringly, Israel is looking great. New Zealand has been a champ through this whole thing as well. We recognize too that in the United States, we're very lucky that we can social distance and take 6 feet away from people, and bubble and all of that stuff. And not to say that it hasn't been very hard here, because it has, but we have certain tools just innately in our culture and in our society. I haven't heard anything, and I think that the experts are saying this is really on us to decide how long we want to deal with this. I mean, thankfully, we're going into a summer. We're going into a time when we can spend more time outside with people, and especially with vaccinated people, vaccinated friends. We can look at having small gatherings together without masks. I mean, that's such a huge deal. If we allow that vaccination rate to wane and to just kind of putter out, that's when we are likely to see that virus develop variants. So the term variant has come up a lot because that's that virus mutating and becoming different than what it had been. And then it might become more infectious and we might get it again. And so that's what we're really trying to avoid with vaccination. So you've asked like the $1 million question, truly. I wish I knew that answer. I know.
The next question is it okay for people with food allergies to get vaccinated?
Absolutely. So the only reason not to get vaccinated or to hesitate is if you are immunocompromised, and then you really want to talk to your specialists about what the timing of your vaccination should look like. So it doesn't mean that you shouldn't get vaccinated. It may be that the medications that you're on precludes you from getting it at a certain time. People who have food allergies, there's no egg, there's no latex, there's nothing in these vaccines. So you should absolutely look at getting the vaccinations as well. So I'm trying to think of any other reason that people would not get it. It's only if you've had allergies to the ingredients, really. But at any point in time that you have questions, especially if you're connected to a specialist who is treating you for something, have that conversation with them. I will say every one of us want to talk about it. We want to encourage people to go in the right direction on this.
One of the things that I saw in your slide was that I think it was on the J&J slide that it has propylene glycol in it. Is that correct? Because I know that the others don't, because they're so, I mean, that's why they have to be so cold, is that they don't have any preservative in them.
Right.
So I'm curious, and obviously this is probably going to be a guess for you, if the J&J might be possibly more risky for folks that do have other kind of allergies, whether they be food allergies or chemical allergies, because there are preservatives and other chemicals in it other than the protective.
Yeah. So, and the information I received, the vaccines are supposed to be preservative free. So that's why they have to be stored all goofy. And I mean, they don't allow us to have these vaccines in our clinics. They are really relegated to specific places. I think you're right, Michael. I think it'll be interesting to see where this develops, what we know more, over time. We're going to know more about the J&J. We're going to know more about the Pfizer and the Moderna, as well as the other vaccines that are out in the world as well. And I mean, that can be pretty scary. So none of us want to be guinea pigs, right? Like, we want to make sure that we know what we're getting ourselves into. I want to really encourage everyone that the process to get that emergency use authorization doesn't mean that the government or the CDC is like, well, sounds good, we just need to do this. They really do go through some strict guidelines to allow that vaccine to pass. I read somewhere that there were like 400 different efforts to vaccine development over the last year. So it's the fact that these 3 have emerged is awesome. And again, we've got technology out there that we just need to tap into. And that's what we see with those mRNA vaccines.
Great, thank you.
Yeah.
So the next question is, this is a fun question. So can we date, kiss, have sex, and feel safe again? What if we are vaccinated, but our partner or partners aren't?
Awesome. So the first answer to that question is absolutely. We are human beings, and to cut off a part of ourselves is just ridiculous to think that we can sustain that over time. So by all means, I think it's so important to see each other, to touch each other, and to engage in activity that really is life-giving. So absolutely, thank you for that. When our partners are not vaccinated, so this is where we can say, well, you are. So you've got some protection there. If your partner goes out without a mask, goes to all the public places possible then yes, you are going to carry an increased risk of exposure. The thing that we don't know about these vaccines is whether or not you can have, once you're vaccinated, can you become infected, carry the virus on, with no symptoms, and then pass it to people. We don't know that information. So I would suggest having those conversations with your partner and saying, this is what I'm concerned with. This is what I feel comfortable doing. As long as, you wear your mask in public or you limit those huge gatherings or whatever the case is. But I really want people to feel that they have some degree of flexibility now, especially after you're vaccinated. See your friends. It shouldn't be a 50-person party per se, as much as we want to do that, but have your friends come over for a dinner party. If everyone is vaccinated, you're really running a very low risk of infection, and see people and love that time with them again, and do what you got to do. It's 2020 was an exceedingly hard year, and the levels of anxiety and depression just went through the roof. And so we're now seeing in this sixth quarter, we're now seeing that our reserves are completely depleted, right? We're utilizing Cheetos more often than we probably should. So, so absolutely.
I'd like to follow up that question with I'm going to be a Debbie Downer for a moment. So, I've been hearing a lot of people that are concerned about truth telling.
Mhm.
And if, so if they're on a dating app or if they're wanting to hang out with their friends, they're not trusting their friends to give them an honest answer. And that says a lot about friendship, but it's also, I think, a concern because we're so hungry, so many of us, to have that connection. So without having a little tattoo on our forehead that says we've been vaccinated, how are you recommending that people can feel trust?
Yeah.
That someone, or do you have to ask people? I mean, like that's kind of awkward. Like, hey,
That
have you
is
been
such a
vaccinated?
great, yeah, that's such a great question, Michael. So I actually had an opportunity to talk to a patient this week about trust. And you may have experienced this before. You see someone, let's get together, sounds great. I'm vaccinated, my partner's vaccinated. Are you vaccinated? And if they say no, then really to have that conversation, be like, I don't feel comfortable in that situation. Or if they say yes, I mean, you're in that situation where you have to really balance out what are those risks, what are those benefits. So if you really want to get together with this person, you're not sure if they're truly telling you the truth, and you're about to see your 85-year-old parent like the next day, is that such a hot idea? You may need to adjust those social that social schedule a little bit. It's hard though. And I think as we talk more about this, hopefully that will bring people a little closer to being confident in, or I think brave to say, wait a second, I'm concerned specifically about X, Y, and Z. What do you think about that? And having conversations to open the doors to building that trust a little bit more. I think that, so I've been doing this now for 12 years, and I feel like every flu season, I'm like, go get your flu vaccine. That's the end. Like, I don't have anything else to say. But really, when people are looking for more guidance, tell me what about the flu vaccine is making you concerned, or how can I navigate that with you? What information can I give to you, or can I share some information with you? I want you to contemplate it and let me know if you have any other follow-up questions. I mean, that's all part of healthcare, but it's also about taking care of ourselves, but also taking care of our loved ones. So our friends and our partners and the people that we want around for a very long time. So yeah, that's such a good question.
And I know it's a really downer question, but I think that, it's one of those things that we're living in a real world with real people, and
Yes.
it's hard. So
yes. And we are hungry for interactions. I mean, I'm so ready to do I'm like, why don't we all meet outside? I mean, outside, yes, and I think about not having anyone in my house for a year, and that sort of thing. We've missed out on a lot of things. We are lucky people. We live in a resource-rich country. We have clean water, like all of that stuff. But I think it's also important to recognize that we have experienced a loss, and we are grieving about certain losses. We've just missed out on things. And I'm hoping that we all can have conversations like the one we're having tonight so that we can move forward. And that 2021 actually is very different than 2020. I wouldn't be surprised if we have more infectious events in our lifetime as well. And we are a global community. It's one of those situations. So we really also need to learn how to care for each other differently than what we probably have been.
Yeah, good, thank you. What other questions do folks have? Because I have more up my sleeve. So, but we want to hear from what you all have concerns about or are curious about.
Yeah. And especially if anyone hasn't received their vaccine, maybe even to say why they may not have, or if they feel comfortable, like just typing in the chat to say, what barriers may, or some challenges that may have arisen. So, and it's hard. I mean, definitely in the last year about this time, we were getting emails probably 3 times a day with the moving target. And it really did feel like we were building the plane while we flew it. So I'm hoping that we finally have a plane that we feel pretty confident about. But even now, things are changing. And I think with the J&J pause, what about the Pfizer? My friend had a really bad response. Am I going to have that same thing? Having all of those concerns aired or at least brought up are really important. It's really important just to be able to process.
So let me pose another one from you teased about it in your slide.
Yeah.
So and this is something that we probably don't know very much about, or that you or anybody who doesn't know very much about, but the J&J and folks that are using estrogen.
Yes.
So whether it's made on their own or ingested some way, would you recommend that people who are estrogenated in some way go for a different non-J&J vaccine? Or
yeah, that's such a great question. I love that word, estrogenated. That's brilliant. But no, that is so. And I think that my recommendation would be, if it should be okay. However, if you have access to a Pfizer or a Moderna, that would be a great option. Simply because if we're looking at these very rare occurrences, but that can really induce a lot of anxiety, a lot of hypervigilance. So is that going to do more harm to your mental well-being than not? Then let's go with a different one. I think it's also important to say that blood clots happen for many, many reasons. And so we navigate the management of blood clots on a regular basis. But with people who either receive feminizing hormone therapy or produce estrogen, from their baseline, I think that it's a legitimate concern. It really is. And until we know more, when we know better, we do better, that sort of thing. But I would suggest for anyone who has concerns that they seek out Pfizer and the Moderna.
Cool, that's great.
Well.
And I don't want to focus a lot on the negative, but I think a lot of people are concerned about that, and folks who are on estrogen are worried about blood clots, or can be worried about blood clots, especially if they smoke, and all of those other kind of confounding or complicating factors. And then I also am kind of wondering about, well, the blood clots are different from what I understand.
Yes.
So not treated the same way, but may have some of the same symptoms. So
right. No, and I so appreciate that question, because I think we've got to bring up those major concerns for sure. Yeah, absolutely.
Good. Another question in the chat. So I know a couple of people who had immediate reactions to their vaccines, but they weren't full-blown allergic reactions. Do you have any idea what might cause those lower level reactions that kind of look like an allergic reaction?
That's such a good question. And I have to share that when I got my first vaccine, I had a lot of tingling in the back of my throat, and I was like, and it went away like 5 minutes later. And I don't know. I think I'm not sure what that could be from. It would be important to know if those folks have had similar reactions to other vaccinations. I also would say, and this might not be fair, but I think it's also just part of the equation could be that anticipation of a response as well. So we all have heard, I'm sure, that second vaccine is going to really knock you out, and that's anxiety provoking. I don't want don't want that to happen. So like to go in expecting something bad can really ramp up our system as well. So, Lori, I'm not sure, but that's a really great question.
So next question is, are there any things that we can do to reduce potential side effects?
Good question. So they are recommending that you don't pre-treat yourself before getting a vaccination. So full disclosure, I did because I don't know. I think it was after that first vaccine that I was like, oh, so I ended up taking an antihistamine and that was it. But which I should be doing because we live in Wisconsin every single day. But I would suggest that just knowing that they can occur, being aware, and then really just symptom treatment. So that pain at the site of the injection, it feels like someone slugged you, but it doesn't, like in a weird way. You can ice that space. You can, ibuprofen, Tylenol, those are safe medications to use after a vaccination. If you're feeling fatigue, low-grade fever, literally take the day off if you can. Take Tylenol, ibuprofen within normal prescribing limits, and rest. I mean, so many people have told me that they literally slept 16 hours after receiving their vaccine. Your body needs that. It's generating, this huge antibody response. Give it the space and the time to do what it needs to do. So if you've got the ability to get that vaccine a day before you have time off, that would be ideal, so that, if you can't take off, then you can at least have some reprieve on a already scheduled day off. But yeah, that's a good question.
And the next question is kind of, the next step of that, which is, do you have any thoughts about suggestions that have been made to prevent symptoms after the shot, like potassium or other things?
Yeah, I haven't heard anything specifically. I mean, really, at the end of the day, I'm just chuckling, which I'll share why in just a second. But at the end of the day, you want your body to have that antibody response. That's what you want. When I've seen people that have like a huge swelling in their armpit or they're really fatigued, literally the response that the infectious disease people are giving is that's a great response. Like they're like cheering for that. So you can rest assured that if you're getting some of those side effects, you can be pleased that your body is doing exactly what it should be doing. You have a very healthy body reacting. So.
So the next question is, a lot of people I know who experience periods were thrown off their regular cycles by the Pfizer vaccine specifically. Do you know anything about this? It wasn't a symptom measured in post-vaccine surveys I took.
Yeah, no, and I agree. That wasn't a symptom that was asked. I've heard this as well. And actually, I read a news article about a school that it doesn't even bear airing, but that this was part of their concern about the way that those periods were adjusted. There has been a statement that's been made too that these vaccines do not have an effect on fertility or the rates of loss pregnancies or anything of that sort. So I just want to say that I haven't heard anything more about it. I guess we could really deduce that it is the fact that your body is reconnoitering some energy and having that response to the vaccine, and that has affected those periods. Stress can affect the way that menses occur. So that, might be in the same boat as the vaccine response. Thinking about other reasons for that. It'll be interesting to see what the data says. I'll tell you that the number of research papers that are coming out are just enormous about responses. So I'd be happy to look that up for you as well, if that remains a concern. But yeah, that's a great question.
That really makes me think too of like, the trans guys or the folks that are on testosterone, will there be any impact on, breakthrough bleeding or something like that if it's having an effect on folks who are regularly ovulating and bleeding? So,
yeah.
And I'm sure there's not been very much research on that yet. So
no, not yet.
Yeah. But we can take our anecdotal polls and figure that out. But that's interesting. Yeah. Mm-hmm. Next question in the chat is, for those of us who received the J&J vaccine, are there any additional precautions that should be taken to given that it's given its lower efficacy rate? Yeah, I can't even read the question. So
That's a good question. So my partner actually got the J&J, and I think that we are doing exactly what we do, which is to wear our masks when we're around people that we don't know, are not in our bubble. We wash our hands. We're just mindful about our social interactions. So no, I don't think that there's any additional precautions. You can rest assured that you are also contributing to that community response to reducing the potential of variants developing. So I think that we can all be very, very happy with ourselves for getting a vaccine and really changing the narrative. So yeah, there's no additional precautions. Again, though, it'll be interesting this summer and early fall to see what kind of boosters, if any, or what kind of recommendations will be made, if any, based on these efficacy rates. So.
Well, and I was gonna say, I don't know if you said this, and I might not have been listening carefully enough, but my understanding is that the vaccines will reduce dramatically people going into the hospital, people dying. So even if J&J has a 60-something% efficacy rate, it's still going to prevent people from getting really,
Yes.
really sick.
That's exactly right. Yeah, thank you for bringing that up. That is exactly right. So these vaccines, they are super effective at reducing almost to nil death rates, as well as the need for hospitalizations. So what does that mean for us? That means that our hospitals are not going to be chock full of very sick people, which will wipe out healthcare providers, will wipe out resources, so that if a person, God forbid, has a heart attack, they can actually go and receive the care that they need in a timely manner, versus deferring that and then having those difficulties. So yeah, I mean, there's so many different implications to these vaccines that, we don't want to get sick, the end of the story, but actually it plays a role in so much of how we access healthcare as well.
And my question or my comment to it I didn't mean to erase, like, let's keep on wearing our mask, let's keep on washing our hands, because those are the important pieces too, no matter what vaccine we receive.
Sure.
So
yeah. Mm-hmm.
Cool. What other questions do folks have? Okay, so another question is it right that all of these vaccines are effective against all variants in the real world?
That's a great question. So these variants continue to develop, and in fact, they're looking currently at India to see what is really driving the infection rate there. So we may actually learn about different variants. Viruses replicate and they mutate. That is just completely normal. That is part of their natural history. So nothing that we see now is unusual. The unusual part is that we're in a global pandemic, and it's, adversely affected our lives. So I think the studies will continue to play out how the current vaccines actually perform in the face of these variants. I think that the CDC, Dr. Fauci, our experts that are really leading the charge at that high level, are encouraging us to get these vaccines to tamp down any potential development of further variants. So yeah, it'll be interesting. And every day, I'm sure that we will wake up to different news about that as well.
Exactly. You mentioned a couple of things that I wanted to kind of circle back to while people are thinking about more questions. You mentioned just a few seconds ago about deferring care. And I think that a lot of folks have deferred care because of, like, not wanting to go in the hospital, not wanting to access things. Are you feeling that it's okay for folks to maybe resume the care that they might have put off, their colonoscopies, their mammograms, their, general lab tests?
Yes. Yeah, that's such a good question. Yes, please come back. I think that, I just had a conversation with a person just this week that they hadn't had breast cancer screening since 2019. They really need to get it. They want to defer it longer. So we really just, talked about the timing for them. What do they feel most comfortable with? Easy as that. I would say for people who are looking for routine care, labs, even colonoscopies, it's time. You can absolutely come in. A lot of the health workers have been vaccinated, you'll also be expected most likely to get a COVID test so that you have that. We all have that information, whoever is involved in your care. And that would just be for procedures. So you wouldn't have to get that test before seeing someone. Virtual visits are not going away. And I think that they will continue to serve a purpose. They're not great for everything, but they can certainly link people to certain types of visits or appointments that are necessary. So I want people to really feel that they have that confidence to come back to their healthcare systems or their clinics to receive their care. I will say that our goal for the last 14 months has been to keep ourselves safe, to keep our patients safe. So anytime someone comes in, you're going to see people with masks. You're going to be expected to wear a mask. That even if you're vaccinated, I'm vaccinated, but we're still going to wear those masks just to continue to safeguard each other. And then you can expect, to wash your hands, really just all the usual precautions. But it is time, I would say, to stop the deferment and come on in. And I would also shamelessly say as well, and I can't help myself, but this is something that I feel very passionate about. We are adjusting exams and adjusting the screenings that people can get to make it a little bit easier than having in-your-face appointments. So for example, and currently I'm involved in this, so I apologize for my shameless, discussion about this, that for my patients who are due or eligible for cervical cancer screening, and who are transgender men or non-binary people with a cervix, you can come in. You don't have to see me, but you can certainly get that screening done through a self-collection process. So like we are editing and adjusting things to make it that much easier for people to receive the care that they need.
Which is very cool. You can self-promote and self-talk about it.
I'm so excited about it.
Yeah, it's really, really cool. Really cool. So we're gonna change the channel. Let's do another question. So the question is, my parents both just tested positive for COVID. About how long will they be immune after symptoms resolve? Or are they immune at all?
Great, awesome question. So the studies that have come out have varying results. So people may carry those antibodies for 1 month, 3 months, 6 months. We're not quite sure yet. Your parents, if they haven't gotten their vaccines, which sounds like maybe they did not get their vaccines, they should also still consider getting vaccinated after their acute symptoms have resolved. So I would suggest, they need to be in quarantine. They need to do what they need to do, and then to consider getting vaccinated 3-4 weeks after that initial diagnosis would be in their favor. Why would we do that? So they likely have an antibody response. So there is some coverage, and I would say in general, we probably work off of like a 3-month period of time, but we can't guarantee that that's going to be everyone's response. And so really, even at 3 months, they can get vaccinated and have, again, that protection for at least 6 months thereafter. That data will continue to emerge and let us know how to navigate, future vaccinations. Some people actually feel better after receiving the vaccination. I know we haven't talked about that yet, but for people who have had long COVID or these longer dwelling symptoms, oddly enough, the vaccine actually triggers something in their bodies and they feel better from that. So there's a lot of good reasons to get vaccinated. And just please tell your parents to keep up their hydration and rest and connect with their healthcare providers if they have any questions.
These are really great questions. And what you just said reminded me of because I went to the health department downtown in Milwaukee, and there were just tons and tons of people, and all the healthcare workers were just like jubilant. They were just like so joyous, like they were just so happy to be there. It was like infectious because people were like they're doing something, like we're making a difference. So yes. I think like what you just said, it's like, you feel a sense of relief, like you're doing the right thing, and like this is like something that we can actually do.
Yes, absolutely.
To change the course.
Yeah, my partner was when they went to go get their vaccine. Apparently, when the 400th person walked in, everyone cheered. The 500th person, everyone cheered. So there was a real community sense to it. I know when I went to go get my vaccine, I asked where the music from Rocky was. I was like, where are the balloons? I'm so excited about this. So most exciting vaccine to get.
That's really cool. It's
Yeah.
really, really cool.
Yeah.
That's why, I mean, I'm not saying that people should go to like some of the mass places, but I think there is like a different energy there. And
Sure.
some people really like that. And some people want to do more of the like the more private settings or,
Sure.
maybe less congested. So
Sure.
we all have our
Absolutely.
different
Yeah.
preferences. Yeah. What other questions do folks have? I have a question that's not exactly medical, but it touches on vaccine hesitancy a little bit and some trans folks' concerns about their safety. And in terms of like safety about being outed, so we talked about IDs already, but maybe safety around getting like on the bus and going to a place to get vaccinated, like having to sit 15 minutes, concerns about what other people may do or say if they're going to be outed, if they're going to get harassed.
Yeah.
And I'm wondering if you have any suggestions for folks that feel that concern.
Yeah. That's such a important concern. I would say because there's such a movement within our community to get vaccinated, I think that, and this really affects 16-year-old people and above, that hopefully that response is going to be as minimal as possible. The other thing is really to address this through potentially a vaccination site or an event that really focuses efforts on bringing transgender people in, so that there is that safe zone that you can come to a clinic that is within the community. People access that clinic for a lot of different reasons, but this would be one of those reasons, is to have a vaccine event and stuff. So yeah, the ID thing is really interesting to me because it is a big concern. And I think that when that can be a major stressor, I would just really want people to reach out to, if you have a healthcare provider, or I would be happy to help navigate those concerns, because really at the end of the day, I want you to be safe. Your lives are valuable, your futures are valuable, and we want to get people at a place where they're safe to re-engage in life. So we can certainly connect people to resources that way.
That's excellent. And I know that on some of like the Facebook groups, like the trans Facebook groups for Milwaukee and for other cities, some people are offering to go with folks. So, I mean, that buddy system is really helpful for any kind of medical appointment, but, some very specific efforts are happening around vaccines. So, I mean, I would encourage people to reach out to somebody that and you could reach out to Forge as well. I mean, we don't have a lot of staff to do accompaniment, but, if you're really concerned about it, we will make a way to, make that happen. So between all of our networks, we want people to go get vaccinated and be as safe as possible. So
right.
Yeah.
Right. Exactly.
Cool. We have about 10 minutes left. We don't have to fill the whole 10 minutes, but what are some other questions? There have been a lot of really great questions.
There's so much about our COVID vaccines and the COVID infection that I was a little concerned, that I was like, I'm going to say, I don't know. We're going to find that out in the future. But this is definitely something that the researchers, I mean, we will have 50 years of data to research now, to really better understand how this virus has affected people, but also how the vaccination efforts have affected people.
And I noticed that in the chat, it's an interesting kind of, it wasn't really as a suggestion, but this person's neighborhood Walgreens didn't ask for ID because they already knew this person. So that's a really cool thing. So if you already have a relationship with your local pharmacy or wherever you can go, that might be a way to kind of circumvent that.
Yeah,
that
that's
ID
great.
requirement.
That's great.
Yeah.
It's really, really good.
Other questions in the few minutes that we have left?
I have to say, I'm just really appreciative of all these questions, because I think just, again, having this conversation and this opportunity to share this information is so valuable. And I'm hoping then that will precipitate other conversations outside of our circle tonight, to maybe empower other people to ask questions and to seek out information, and maybe even the vaccination. So that's great.
Very cool. Annie, do you have other things that you want to make sure that get shared tonight before we check out?
Yeah, I think our take home points really should be that these vaccines are safe, they're effective, and they have the potential to really change our current life situation, where we can reconnect with our friends, our family, our loved ones in a way that really has been restricted over the last year. I mean, the idea of travel, like we can actually utter that word now. So I want people to know that vaccination is really a powerful tool. With that being said, please continue to mask, even if you're vaccinated. This is all about community. This is about keeping other people safe and also living in solidarity with everyone, that this is a community effort. Washing your hands and seeking out healthcare when you need it. Now is the time. It's okay. It is safe to come back if you haven't been engaged in the last year. I would also really encourage people to do so, because a lot of us have really taken some major hits in terms of our mental, our emotional well-being. So make sure that you're connecting with people. But if you have any further questions, I know that our clinic and then many of us are very happy to navigate those questions. So please know that people are out here just waiting to have this conversation.
Cool. There is one more question. Can we do more?
Great.
One more question? So the question is, I've seen some sources say that cis women should avoid getting a mammogram right after getting the vaccine due to a temporary swelling of the lymph nodes. Does the same apply for trans masculine people and assigned male at birth folks on estrogen?
Yes, great question. I'm so glad you brought that up. So yes, for any person who may need to have any kind of mammography testing, you want to wait 4 weeks after that second vaccine. So that would be an appropriate deferment of care, because we know that that swelling can occur, and that will put you down a rabbit's hole of needing further evaluation, when in fact it's related to that vaccination. So yep, so the recommendation is to wait 4 weeks.
This is cool. I bet everybody has learned at least one thing, if not 100 things tonight. So
awesome.
Really, really cool. I have popped in the chat an evaluation, the Inclusion Clinic website, Forge websites. If there's anything else anybody wants to stick in there, that is great. But I want to thank you so much again, Annie, for like being here and you're always so like cheerful and happy and so like patient focused and person focused and kind of a straight shooter, which is really awesome. Yes. So I think that, a lot of us really can listen to what you say because you're authentic and we can trust you. And that's really wonderful. It's really wonderful.
It is my gift to be here. So thank you very much for the time tonight.
We can have some mutual love, which is really, and Derek can sign the love thing too, because I love watching Derek who does the love thing. So we are really thrilled that you were here. We will clean up this recording and make it available, so hopefully a wider group of folks can access it and reduce their fears if they have them, and go get their bodies into a place that they can get the Fauci ouchie and have some fun. So let me just do the 2 events that we have coming up next. So coming up next, May 11th, we're gonna, Shelley is gonna talk about the Biden's first 100 days and what some of the trans advances are. Not very many trans non-advances, but what's happened in those first 100 days. And Laurie and Shelley are both gonna do that together. I forgot, I'm sorry. It's a joint event. And then on May 25th, we'll have a panel discussion on safe dating in the age of COVID. So both talking about intimate partner violence, hookup apps, and some of those things like, can you kiss people, which we talked about tonight. So, but we'll have a panel of folks to talk about that. So Laurie and Shelley is May 11th, and then the panel discussion on safe dating is the 25th. So thank you everybody for being here. Thank you, Annie, for being here. And we will hopefully see everybody in a couple of weeks.
Awesome.
Good night, everybody.